Hi everyone, my name is Saeed Hashem. I am a board-certified geriatric psychiatrist working in the outpatient division at McLean Hospital. I am also a clinical researcher within the geriatric research program at McLean, and I work as a clinical instructor of psychiatry at Harvard Medical School. And today I'm going to be talking about major neurocognitive disorders, offering an overview that should be helpful for primary care providers, nurse practitioners, physician assistants, residents, and young learners caring for older adults. So I have to acknowledge that this presentation is supported by the HRSA grant from the US Department of Health, but the contents of the slides that I'm sharing over this course only represent me and do not represent the official opinion of the US government or the Department of Health. I do have some conflicts of interest that I should share, that I work as a co-investigator on active clinical pharmaceutical trials with Biogen and SI, investigating the use of monoclonal antibodies in MCI and early Alzheimer's disease. I'm also going to be discussing some off-label therapeutics for Alzheimer's disease and related dementias that were discussed in published medical literature. So in order to stick to our age-friendly health system initiative with the famous 4 M's that we follow through our work, I want to emphasize that during this course, I'm going to be focusing more on what matters and mentation for older adults. So let's talk a little bit about the history and some of the definitions in the neurocognitive disorders space. So here's a historical perspective. Dementia has been always recognized as a medical condition for many centuries, and it describes a range of symptoms that are mostly related to cognitive issues. It comes from the Latin word demens, which means losing the mind. And in ancient times, dementia was often attributed to supernatural causes or just considered a normal part of aging. So the history goes back to the 7th century BC when Pythagoras divided the human lifespan into 6 distinct phases: infancy, adolescence, young adulthood, middle age, old age, and then advanced age when we're talking about above 80 years old. 63 to death was labeled as the phase of senium, and that's how the word senility was derived. He described this senium as the scene of mortal existence, closes after a great length of time that very fortunately few of the human species arrive at, and where the mind is reduced to the imbecility of the first epoch of infancy. So he's describing some sort of regression in the cognitive faculties as you enter this phase after 63. And then in the 17th century, English physician Thomas Willis first described dementia as a medical condition caused by brain damage rather than just a part of normal aging. In the 20th century, we saw significant advances in research because of the advancement in pathological sampling, how we preserved brain tissue, which led to further discoveries. So in 1906, the German psychiatrist Alzheimer discovered the presence of unusual clumps and tangled fibers within brain neurons. And thanks to Ronald Reagan, Alzheimer's disease gained further recognition and momentum in funding that helped us a lot to spend more time studying how to diagnose and treat such a disease. So today, the term dementia is still used among the medical community as a very collective term, but in recent classification, we now use neurocognitive disorder to describe this constellation of symptoms and reduce the negative connotations associated with the word dementia.